Welcome back. In this video we'll be talking about circular Foley's strokes and aneurysms. So this is the circular Foley's, and as you can see, the blinking parts above are the internal carotid arteries and below are the vertebral arteries. And these four arteries are the main organ or supply of circular Foley's. If you have blockage of the anterior cerebral artery indicated by the arrow shown here, you will have motor loss of the contralateral lower limb and sensory loss of the contralateral lower limb. Medial cerebral artery inclusion will result in motor and sensory loss of the contralateral upper limb. And if it involves the dominant parietal lobe, it will cause aphasia, and if it involves the non-dominant parietal lobe, it will cause neglect syndrome. Posterior cerebral artery inclusion will cause contralateral hemianopia with macular sparing. Basilar artery inclusion will cause locked-in syndrome. It's a horrific syndrome where the patient would be completely paralyzed but he'd be conscious and aware of his surroundings. So the patient would seem comatose but he would actually be awake. ICA, or anterior inferior cerebellar artery inclusion, will cause lateral pontine syndrome. This will cause facial muscle paralysis and loss of pain and temperature sensation in the ipsilateral of the face and contralateral of the body. PICA, or posterior inferior cerebellar artery, will cause lateral medullary syndrome. Patient will present with dysphagia and hoarseness, and he'll have the same pain and temperature loss in ipsilateral in the face and contralateral in the body. Anterior spinal artery will cause medial medullary syndrome. This will cause tongue deviating toward the lesion, just remember the mnemonic lick your wound, and contralateral hemiplegia. Now let's talk about the circular Foley's aneurysms. Aneurysm in the anterior communicating artery, which is the most common site for aneurysms, will result in optic chiasm compression, which will result in bilateral temporal hemianopia. Common risk factors are Ehlers-Danlos syndrome or autosomal dominant polycystic kidney disease. If the artery ruptures, it will cause subarachnoid hemorrhage. And posterior communicating artery aneurysm will compress the third cranial nerve and will result in the third cranial nerve palsy, which is down-out blown pupils. If it ruptures, it will also cause subarachnoid hemorrhage. Alright guys, that's everything I've got. Hopefully I made this easier for you, and see you guys later.